they go through the other, do this, do the other. There are do's and don'ts. If you actually do them, you go through them. Of course, survival also depends on the level or the staging. We talk about cancer staging. So I talk about some of those things in the book. Now, these are so many other chapters: chemoradiation, more unexpected treatment, Dr. Solomon knows. Then there's this, the mango delicacy and the day-long painful blockage. After surgery, after chemoradiation, after chemotherapy, after all those things, I think I was remaining only with the reversal surgery. I felt like I think I was now good. I was now eating, my appetite was good, everything was good. And I was also playing football with my family. We do a family football. And in the book, I say that day we played and even we won Catherine's team. Yes. But I also thought maybe functionally or function-wise, my ileostomy was good. And she kept saying, don't give him the other. But now there are some mangoes in the fridge. I went and removed with my son. I ate everything with the pills. What was the next blockage? I called Dr. Chang. Where was he? He was in Kenya. It was a weekend. And, well, you read the story in detail because it's in that book. Yes, but I want to thank God that I overcame and went about it. And of course, there are other more chapters, the reversal surgery, reversal complications. And I think one of them for me that really stood out, levofloxacin. I didn't know I was going to react to this drug terribly. I responded so terribly that I was almost losing myself. Like, I was almost running bad. I started hallucinating. I started doing, all those things, and it was difficult. But when finally I got to know that it was it and I discontinued the drug, I went over it. So all that information is there. And then, of course, the low anterior section syndrome, following the surgery of the rectum or the colon. I mean, you have distorted the the normal functioning of the system. You have shortened. You saw Dr. Chang presenting the different. Whatever was in blue, was that blue color? It means that is what you're going to cut off and remove. Then they shorten, isn't it? So that means that if you have your rectum, which was 15 centimeters, then they remove maybe 10 centimeters or 5 centimeters, you can get the difference. So it becomes short. So there are many things that follow that procedure. So there are those low anterior section syndrome or a lot of group of symptoms, and these present different. So I briefly talk about them and what I did, what I went through, and what happened to me. I talk about those, so they're in that book. Then I talk about diet and feeding, my own experience and what we learned. Maybe what I also talk about, Dr. Mugabe, we don't have clear guidelines for some of these things. When I do colorectal surgery, when I go undergo colorectal surgery, what am I supposed to, in what quantities? These guidelines are very critical for patients. Like, you just have to navigate your way to go through. You try out, and when you try out, you're burnt. When your finger is burnt, then you run away. You try something else. By the time you discover where you're supposed to be, it's too late. Let's move on. Yes, of course, at the end of the day, I thank God that the hand is fully restored. The tumor is no more. Of course, I'm off the cancer drugs. Yeah, they are very aggressive. That's a reality. The bug is no more. I worked for the bug for a whole 1 year. Of course, minimal to mild loss. I resumed my work. And this is a reason to give God glory. Let's go on. Now, I finish with this. We are public health. And we are public health. There's no we cannot advocate for improvements. So these are really lessons following my own experience. Number one, we need to improve awareness, address fear, denial, and stigma cancers. These are really terrible. And the outcome of these things is always a negative outcome. We need to address knowledge and skill gaps, also among healthcare workers, also providers. One of the examples I give is that when I went to the hospital, the private hospital, Dr. Chang, of course, had to leave. I mean, the team there that remained had no idea of how to deal with uh, this bug when I got complication. The little knowledge that he had given to Kathy is what actually was used. She was used to start to inform, what did the doctor say? What did he say about this? So we need to really improve, these skills. It's even like, for example, even the nurses, because they are there, they remain always there, provide this service when the doctors are out. Of course, they need to address medical errors. I think I'm a little bit bold. There are a lot of medical errors that I personally experienced. So if I keep quiet about them, nobody will speak. speak about them. I think we need to tighten, you know, there are leakages in the tap. We need to really tighten those. He's in town. The doctors refused. They said, well, we need to find out more. I took the same sample to another facility. Then another facility. Everything was just wrong on the medical report. Even myself, I circled ISS patient. You know, I was like, really? Then I said, I reached Dr. Kwesi. He said, Dr. Kwesi, we cannot accept that result. Report, take it back. Now you see, that would mean a completely different treatment course. So there are really, really genuine gaps there that require addressing. Of course, gaps in ileostomy care are glaring. And of course, this I appreciate because these are new, these are really recent surgeries. So we need to have those addressed. They need to improve access to these supplies because they are not really readily available. We can go to the next slide. Diet and feeding, I've talked about this. Patient support group. Patient support groups. I think even from the time I posted that I've written a book, there are some patients that have actually followed up just find out, get a bit of support. I really think this is some of the areas the Cancer Institute can actually be intentional to have this happen. Of course, post-ileostomy reversal complications require attention. These particularly the ileostomy, colostomy, or other whatever, I think still a young field that require attention. Diagnostic and treatment costs, the costs are screening, managing, and treating cancer are really, really very high. I was supposed to do a colonoscopy examination as a surveillance, a follow-up with Dr. Chang. But what happened? His equipment was down. He said, go and do it outside. You heard in Mlago, it's how much? Where he went to, it was 1.5. And you don't do it only once. As you heard, I'm supposed to what? Keep on what? Going for these revisits. And that's not the only investigation, there are more. So I think, Dr. Mugabe, these are some of the areas. And me, I think, also in the private sector. I really think, this side, even in the private sector, yes, we appreciate, but the truth of the matter is that at the end of it all, the goal should be to help us meet the needs of these patients. Let's go on. The whole story in 5 pages, what I finished in that chapter, and that is available for you to read. Thank you so much, and I appreciate your coming.
Thank you. Thank you very much. Dr. Musinguzi, I'll invite Dr. Margaret to invite our next.
Thank you so much, Dr. Geofrey Musinguzi. Let's give a big hand clap to the Almighty God. And another round of applause to Dr. Geofrey. Dr. Geofrey, thank you so much for being resilient, being adherent to the medical instructions and the drugs despite the negatives that you had. Indeed, you have told us a story, and it should not end in this room. Our next item on the agenda is reflection on the book by Professor Hilda Bastians. As you have heard, Professor Hilda Bastians is from University of Antwerp in Belgium. He has worked a lot with Dr. Geofrey Musinguzi and other colleagues at the School of Public Health. He has supervised many PhD students, including Dr. Geofrey Musinguzi and myself, and she is still supervising many others. Just this week when she came, she was listening to some presentations of 3 potential PhD students. Professor Hilda Bastians, whenever we go to Belgium, he welcomes us very warmly. He welcomes us to her home. He drives us around. It's very rare to find such a person. So join me and we welcome Professor Hilda Bastians, who is working on the project they are working on is in Mukono and Wikwe districts. It is scaling up packages for cardiovascular diseases prevention in selected sites in Europe and Sub-Saharan Africa. And in Sub-Saharan Africa, one of the countries is Uganda. Professor Hilda Bastians, you are very well.
Thank you, I agree for the introduction. Good afternoon, everybody. First of all, Geoffrey, congratulations with the launch of your book. And thank you for inviting me to give a brief talk and some reflections about the book. It's a real privilege to attend this important event. Because of a second, I think this book launch is also a tribute to how you handled being sick, being a cancer patient. And I have a lot of respect for your courage, fighting spirit, strong belief in God, and optimism, which is also reflected throughout the whole book. And finally, I think this moment is important because sharing your story, your intent to support others who are going through similar things, I think it's really nice. You also aim to raise awareness around colorectal cancer and the importance of recognizing signs and symptoms and to act upon them adequately. So I admire also your dedication to writing this book and how you were able to turn a very severe and life-threatening experience into an opportunity to support others. Can I get the next slide? So we have known each other for quite some years, 11 to be precise, from when you acquired a scholarship to stay a few months at the University of Antwerp to work on a research project. And then our collaboration continued from then onwards, first with your PhD on hypertension, of which we see some pictures here on the right-hand side. It's you presenting at the hypertension conference that you organized. That was actually also the first time I visited Uganda, 2015, and when I also met your family with your children, who, when I met them 2 years ago, have grown a lot. And then when I read your book, the next thing that we did together was the Spices Project. And you see here the team, the Spices family, as we call them. And then we worked together in that project from 2017 up till 2021. Now, when I read your book, I realized that how you managed your disease being a patient, this is also for me how I know you to be as a person. Conscientious, perseverant, and at the same time, genuinely caring for others, even when you have a lot of battles to fight yourself. I also recognize the strong conviction in wanting to improve people's health and your ambition to make positive contributions wherever you are able. And I think these are things I experienced in working with you for 10 years, and these are also things I saw coming back in the book. So this group picture of Spices, it also linked to the next point I want to make is that your book is a story of a very tough journey, but at the same time, it is a story of strength, hope, and the importance of family and friends. So like you say, cancer is not a one-man battle. And this one aspect of the book I found quite heartwarming. How many different people walked a little or a longer part of the journey with you. And I personally also experienced the importance of your family and friends when I was here in August 2022, not long after your first. I really value is the fact that you managed to also write it as a hopeful story with also a lot of humor. Like at a certain point, you speak about food and you state that you eat calculated junk. Yes. Okay. What I also really appreciate about the book is the fact that it is both supportive but also informative. So Dr. Musinguzi succeeded in telling his story in a manner that readers can really share part of the experience. And I imagine that people going through the same thing really can recognize that and can be comforted by it. It provides factual details as well as information on the impact it had on himself, his family, and it also tells about the struggles and also his trust in God and how this helped him. Next to that, the book gives also a lot of good information, which Geoffrey already talked about the disease, its treatment, the diagnosis as an accidental diagnosis, and also on what signs and symptoms he already had and were not recognized in time. And I think this story will stick to people and will also help people to react early and recognize them. Yes. So before I move to the last part in relation to the book, I just want to take a very brief moment to say something about the bowel cancer awareness screening in Flanders. So what you see here is about the screening program. We've had it for some years, not that long, but actually how it works is that it's based on looking for occult blood in the stool, which we already heard about. So all people aged 15 up till 74 will get 2 yearly by mail in the post a self-test. So they sample themselves, they send it to a screening center, they do the tests, and then they inform patients by a letter, or patients can access their electronic health platform where they can look, and also their general practitioner is informed. Then actually, if it's negative, you get a new invitation in 2 years. And then when it's positive, they advise you to go to your general practitioner. They also follow up whether you do that, and then you will get a colonoscopy. And actually, coming back of one of the questions, in what we do in Belgium, the practice is if you have had a colonoscopy and it's normal, then you normally only get one in 10 years, except if there is some family risk. So that's how it's done in Flanders. And then the next slide. So this is just, it's in Dutch, it's the invitation that's sent around. But the important thing is that they also mention things to pay attention to, because it's not that the occult blood test is 100% safe. Things can be missed. So that's why they also try to educate people on very simple things actually to pay attention to. If you have blood or mucus in your stool, go to your GP. If there is a change in your normal bowel movement pattern, also have it checked. If you have frequent abdominal pain or cramps, or if you're feeling like you need to go to the toilet when you really don't need to, and when you lose weight for no reason, these are all signs that are put to people as, if you have them, please go for a checkup. And of course, if several people in your close family, parents, brothers, sisters, children, have had colorectal cancer, then that's also something, an indication to go to your GP. This was a brief intermezzo which I wanted to share. Next slide, please. This I can be very brief about. So finally, what I also think is an asset of this book is the fact that Dr. Geoffrey had the openness to also talk about medical errors and mistakes and shortcomings in the health care system. And he does not describe them, in my opinion, as critiques, but he describes them as critical incidents, opportunities to learn, change, and improve things. And from his experience, he derived a number of recommendations, which he already spoke about, so I will not go into them. And actually, I'm a general practitioner by training, and I still work one day in clinical practice. So I actually also picked up on some reading the book, like being again aware that explaining and supporting patients is important, making sure that they understood me, making sure that they know what to expect if I refer them for a colonoscopy. And also, if there is something like, for instance, what to eat after you had surgery, it's something that I don't know as a GP, but make sure that you refer people to professionals who know, so that you really can support their trajectory. So all of that that I've talked about makes this a very valuable piece of work, I think. A personal and honest story that can support people in going through similar experience, and at the same time calls upon all of us, community healthcare providers, policymakers, to be more aware of the signs and symptoms of this disease and improve healthcare around colorectal cancer. And I just want to briefly pick up on something that was said earlier on the fact that you as a person are responsible for living a healthy life. And I think that's for a big part true. At the same time, I believe and that a government can also play a role there. Maybe a very simple example, like for instance, we used to have in schools, like those things where you can pull out drinks, and they were sugary drinks. And the school actually got some revenue from doing that. And that's why it continued. But now what they did is now it's only water and healthy drinks that are available, and they negotiated some other way of doing that. And I think it might be a little bit the self with the alcohol. I know it's a really complex thing, balancing the economic and the health, but it might be useful and helping to also support people from a government perspective. Okay, last slides. I want to end with some wishes. So first, Geoffrey, writing the book, organizing this event was a lot of work. You had also a very intense 2 years. So I wish you some rest and quality time with your family and friends. And Catherine, I wish you the same. Then second, I wish that it will be possible to realize at least some of the recommendations that you made in your book. And I think a number of people present here can maybe help doing that. Next, I wish that you can continue to be an inspirational researcher and advocate for a better and healthier society. And hopefully we can find some grants to maybe work together more on some research projects. And finally, and above all, I wish you good health and happiness.
Thank you. Thank you very much, Bastian. Another round of applause for her, please. Okay, we'll go to our next session. We've had a lot from Dr. Geofrey Musinguzi. We'd now like to hear from someone else who has had an experience with cancer. First, before that, I'd just like to appreciate and recognize again cancer survivors. I'd like Miss Rusia Okiriza to please just stand up and wave so that we can celebrate you. Today is the day to celebrate people like you. Thank you. Thank you very much for sharing your story as well. I'd now like to invite Mr. Andrew Lubega. Mr. Andrew? Yes, Mr. Andrew Lubega to come and share his story about cancer, his experience with cancer in 5 minutes. So that we are. Please welcome Mr. Andrew Lubega.
Good evening, everyone. I know they invited Mr. Andrew Lubega. That's my dear wife, Dina. Mine will be a brief story. I'll just start with it. I just felt like a toothache, just a normal toothache. And that was 2020. So I went and removed the tooth on my left-hand side. And from that time, that's where now the severe pain started. It was just a headache, but a severe headache. If you've had one, you know what I'm talking about. So I took painkiller. Healthy. Some of you are even more healthy when they talk about health. Some of these things will happen for God to glorify himself. So I went back to the dentist. I told her, when you remove the tooth cases, you think it is something else, when it is totally something else. That's what I thought. So I went and did I went to the ENT because I was helping. Because I was having a problem with my ear. I was I was getting deaf, my left ear. I could not hear sometimes. And I was feeling like there was a sharp pain in the ear. Nothing related with the throat, because what I was having was a nasopharyngeal cancer. What I was having, it was totally different. I could not even think about it. So after everything I did, ENTs after ENTs, the best, they took me to the best now. That's when the guy told me, I'll not eat your money. He was very sincere. I'll not eat your money. but what I'm seeing is what other people are seeing. Maybe you can try a scan. I came to, we have a friend who was working at Cancer Institute, Molago. I don't even know how all of a sudden I went to Cancer Institute after everything. Now that was um, from January 2020 to July 2020. Throughout the lockdown, my wife will tell you the truth. I could not even sleep on the bed. The pain was severe. The head only. The rest of the body, if you could see any of my pictures, I don't know whether they were put up. The rest of the body was very okay, but I would have a severe headache. So we did the CT scan. They told me there's nothing. It was a head and throat. I took the results back to the Cancer Institute. I don't remember the doctor's name well, but he told me, what's this what the team has said? There is nothing. But their head requested for my results and said, I'm seeing something small in the pharynx. I think pharynx is this place. I don't, because I'm not a scientist and what. Can we do an endoscopy? When we did the endoscopy, sincerely, the news came out. It took me some time to tell my wife. That was July 2020. Yes. So she kept on asking me, why are you going back to hospital? Things like that. I know they want another test because I wanted to ascertain that really it was cancer. It wasn't the best news to receive at such a point of lockdown, no work, people in their houses. You get to know what I'm talking about. I remember what Dr. Musinguzi talked about here. He said also negligence of some medical people. When I did the endoscopy, I took the samples. One to Mulago Medical School. Truth is, when I went back on Tuesday, when I went, where are my results? He's like, did you read here? Okay, come back at 2. Didn't even know where exactly he put it. Now that is negligence. You're playing on someone's life. If you're a medical person here, please, whatever it is. I took the other sample to Cancer Institute. It took like 3 months, 3 weeks, like 4 weeks. They gave me those bad news. Very sad. To cut the story short, a friend of mine advised chemo, death sentence. What else? Death sentence. And I said, true. Let's try it herbals. From 2020 to October 2021, I was doing herbals. I'll tell you, I took everything. Marijuana, this, that. Nothing, truth is, nothing would take away the pain. Because I was given those things to kill the pain. None of them would take, if you would rate it, 10 out of, I would tell you it's 15 out of 10 because it was too much. Cut the story short. 2021, that's when the pain was severe. My wife has a friend. She advised us to do another test. I did another endoscopy, a second time now. The first time it was 2 centimeters. It had grown to 6 centimeters. And I could not even stand or turn. I would just be one side. And the ear, now that one had lost it. I could not hear anything. Unless when you talk, I turn just to listen. Still, to cut the story short, after the endoscopy, the doctor told me it has grown. What do you do? My wife asked, what do we do? He said, it's treatable. That was the hope I got. But within me, if I talk to any of the people around here, I had the hope. I would tell myself in scriptures, I will live and not die. That's The only thing that kept me alive. October 1st, I traveled for treatment. Whatever they told me was, the book of Job says, what I feared most. That's when Job said, what I feared most has happened to me. No, that's what I feared most. Chemo. I went, the doctor told me it causes barrenness. The first, doctors, what you tell people, causes barrenness, causes this, causes that. Can we do your sperm bank? Can we put your sperms in a bank? I told him, God gave me 2 children. By that time, the second one was on the way. I will stay with those. If it causes barrenness, it's okay. Let's start the treatment. I don't know where I got the courage, but I did chemo 16 sessions from October 6th. October 7th, that's when my wife gave birth to our second baby. October 7th, October 6th, I did the treatment. Now, I didn't count my pictures, I think were not put up, but for other patients and even the doctors, they were shocked. For chemo, Dr. Musinguzi and others who have gone through it will tell you, it makes you lose weight. I put on weight. I put on I was 52 when I went to the hospital. Imagine a fully grown up man, 52 kilograms. That is underweight. By the time it was end of that month, October, I put on 27 kilograms. And the doctors was like, are we putting water or something else? I told them it's chemo. I didn't lose weight. I just put on weight. That's one thing that kept me positive. After, what I feared now most was radiotherapy. Other patients would also tell you, I did 35 sessions every day, Monday to Friday. Now that one, thank God you didn't see the pictures. It was, and at last I told the doctor, please, can we stop here? He said, no, you're about to finish. Because I was giving up. But hope kept me alive. I'm grateful to God, my family, my wife. As I was battling cancer, she kept on saying,